Hello, this is Team 10, and we'll be presenting Case 2. So, just as a table of contents, we split our case presentation into 4 sections for organization. The first part will be collecting pertinent subjective and objective information to basically just understand the patient's current situation. Then we'll be moving on to assess, where we'll be evaluating the information that we collected from the prior step. After assessing, we'll make a plan and implement section. Here, we'll develop and implement an individualized care plan that will take into account the patient and their current needs and what their therapy goals will look like. And then after that, once we plan and implement, we'll do a follow-up where we will monitor and evaluate the effectiveness of the care plan and modify it to the patient's needs.
Our patient BW is a 23-year-old male who is currently employed. He came into the pharmacy today due to his untreated knee pain and inflammation. This pain and inflammation occurred after prolonged physical activity of spring cleaning the day before. And although he has tried icing his knee, he is still at a pain level of about 4 out of 10. And so far, he has no known allergies or adverse drug reactions.
The pharmacy does not have information on file regarding BW's use of alcohol, caffeine, tobacco, or recreational drugs. We also are not aware of any past surgeries or medical conditions. We will collect this information at the next visit. BW is hesitant to take acetaminophen due to possible liver damage. He is also experiencing problems with mobility due to his current knee pain. BW has no other known alerts.
During our assessment, we found that our patient's indication or condition is knee pain and inflammation. Our goals of therapy for the patient are short-term. So we want to reduce BW's knee pain from a 4 out of 10 to a 2 out of 10 within 1 day. And then for long term, we want to eliminate knee pain within 10 days indefinitely.
So for BW drug therapy problem, he need additional drug therapy, an indications problem to control the knee pains and inflammations because he's not currently taking any medication to treat the symptoms. We also, in terms of therapeutic options, we suggest that he could use NSAID such as ibuprofen, aspirin, naproxen. Topical lidocaine could be helpful. Also, counter irritants such as menthol, camphor, methyl would be a suggestion for him. For non-pharmacological, use heat packs before activities, ice after activity, and consider physical therapy or exercise to strengthen the muscles around the joints. It may help alleviate the pain and improve flexibility. Also, use PRICE acronyms such as protect the injury, rest for 1 to 2 days, ice as soon as possible, compressions with elastic band-aid, elevations of injury above level of heart.
On slide 9, we have BW's updated medication list. For the indication of knee pain and inflammation, we have ibuprofen 200 milligram tablets. BW will take 1 to 2 tablets by mouth every 4 to 6 hours as needed for his knee pain, with a max daily dose of 6 tablets or 1,200 milligrams. This is a new addition, so we're going to start this medication on 3/29 of 2022. And then this is one to be taken with food. And this is as the updated med list. There are also additional interventions that would include some of the non-pharmacological therapies we listed earlier, PRICE, and the prevention of additional injury.
The last slide about follow-up evaluation. We will follow up with patient in 1 day. Day will be 3/30/22 via the cell phone. We will discuss the effectiveness of the suggested pharmacological therapies and lifestyle changes. BW's knee pain should be at least 2 out of 10 or below by the time of the follow-up. If this goal is not reached, the treatment plan will be adjusted. The patient will be instructed to contact their doctor if the pain still persists after taking ibuprofen for 10 days or if any severe adverse effects occur. Question for the patient: what would you rate your pain on scale of 0 to 10, with 0 being no pain and 10 being the worst pain you have ever experienced? Has your knee inflammation gone down? Have you experienced any side effects such as chest pain, shortness of breath, difficulty breathing, mouth sore, diarrhea, blood present in your vomit, fever, chills, hearing loss, depression, poor depth perception, black tarry stool, or yellowing in your skin or eyes? Thank you so much for your attention.